all these classes are going to be recorded, but this is a chiropractic 101 basics. When you look at human beings, you've got a group 50, 60, 70, 80, good bodies, good brains. You've got a people 60, 70, 80, 90, bad bodies, bad brains. The only difference is one's regenerating. Now, when we look at this, a normal spine, now, no chiropractor cares about the spine. No chiropractor cares about the muscles. None of that stuff's important. But what this protects, you've got a bony case that protects the most sensitive system in the entire body. It regulates and controls every function. Does this central nervous system control hormones, estrogen? Yeah, testosterone, digestion, blood pressure, regulation, tissue production, everything. That's why it's encased in bone. Now, the way it's built, we're built to have the head over the pelvis. So this is actually a really good configuration. Now, the brain, which only weighs about 1 kilo, but it burns 90% of the body's oxygen. And so it also creates its own food called cerebral spinal fluid. Now, that fluid's produced in the brain, and it drains through this central canal to give nutrients to the spinal cord. Now, let's say that, and this system is fantastic. It's supposed to be straight and curved, and it's built this way so it can take a huge stress and not have a problem. But now let's say that there's a loss of curve in the neck, or even worse, a reversal of the curve in the neck. What that's going to do, it's going to not allow the fluid that's produced in the brain, it won't drain as much. So when we see a loss or reverse curve, the brain literally starts to get compressed. And in fact, we can see that by testing the suture, the top area of the brain. It can be swollen, it can be hot, it can be inflamed. And that's because pressure is building up in that skull. When you see somebody with autism or brain damage or Parkinson's or dementia or brain fog, they're all going to have a flaming mohawk right in the middle. It's called the sagittal suture, okay? And by just restoring that curve, even a little bit, that tenderness will go away within a day. It could be even less. But this nervous system controls immune system, cholesterol, blood pressure, everything. And so when we're looking at this, we're not measuring blood pressure. We're not measuring cholesterol. We're not doing any of that because the body is responding correctly based on the stimulus. So let's say that you're normal. Your blood pressure is going to go up and down. Let's say you've had a trauma. Your blood pressure is going to respond to a stress state. And this whole human being only has 2 switches. And they're called the automatic nervous system, or autonomics. You could be in stress or regeneration. Sympathetic means fight or flight. Parasympathetic is regeneration. So if you have a physical stressor like this, it puts you in a stress state. And just like if you're running away from a tiger, blood pressure goes up, cholesterol goes up, bowel function goes down. I talked to a patient yesterday that had 1 bowel movement a week, and her medical doctor said that was normal. Okay, that's toxic. Poor sleep, anxiety, low vitality, sexual function, blood sugar goes up. All of this is a normal response. But now in today's society, people will say you have type 2 diabetes, you have high blood pressure, you have high cholesterol. And when you ask the doctor, they'll say, well, it just runs in the family. The doctor is smarter than your own physiology, so he's going to give you a drug to lower your blood pressure or lower your cholesterol. Now, that is not only stupid, it's completely ignorant that the body is self-healing and self-correcting and self-adapting. So if you run upstairs, your blood pressure has to go up. If you're sitting down relaxing, the blood pressure should go down. If your blood is healthy, it's going to go up and down based all throughout the day. But so what chiropractic is, we're not doctors of the bones, we're not doctors of the muscles, none of that stuff makes sense. We're doctors of the nervous system because it controls and coordinates every function of the body. even though chiropractic adjustments will regulate blood pressure. We're not doing that. The body is going to respond correctly based on the environment. So what we do is assess the structure, correct the structure, and then the body can function correctly. There's three things that you have to address: physical, chemical, emotional stress. The physical stress you identify on x-ray. Now, if you have a doctor that diagnosed you with a stress response, and I mean high blood pressure, blood sugar, immune system, bowel function, anything, and they're not looking at the nervous system, which controls everything, is that a bad doctor or a bad doctor? I know, but we're in crazy world. Type 2 diabetes is 95% or 90% of 95% of all the diabetics in the world. And within a month, that can be cured. Nobody has high blood pressure, but they have a stress response or abnormal pressure. Now, when you identify, say, a reverse curve, loss of curve degeneration, understand that these joints are alive. And so when you have a reverse curve, which means there was a bad trauma in the neck, and you slowly bring it back to normal, and if you have grade 2 arthritis, which means the problem's been there 10 to 15 years, you can start to show changes in 2 weeks. We can get post x-rays. We can show changes. But if that problem's been there for 15 years and it's grade 2 arthritis, or it's been there 30, 35 years, that's grade 3 arthritis, how often do you think you should make sure that this neck is corrected and stable? It's kind of like working out at the gym. Like, I worked out this past weekend and I feel great. Should I wait till I hurt before I go back to the gym? No, that sounds stupid. The weird part is 90% of the nerves coming off this spine, there's no pain fibers. So we're in a society now that says, well, I don't hurt, so I must be okay. But when we're looking at this, if you've had a problem in the neck for 15 years and you're sitting at a desk, which throws the head forward, this is why we give exercises to restore the curve, to get the curve back in the neck, why we give movement exercises to restore the fluid to these joints. So in fact, if you've had a reverse curve in the neck in grade 2 arthritis, that's going to take 6 to 8 years to correct it perfect. But that's you doing the exercises every day. If you want to train for a marathon or train for hiking a mountain, that might take years, but you got to do it in order to achieve the goal. To reverse the damage or degeneration of the lumbar, the low back discs. Discs are alive, they can regenerate. Symptom relief occurs in 8 to 10 adjustments. You start to notice a difference. We do post x-rays at 30 adjustments to document that it's getting correct. But how long will it take to reverse grade 2 or grade 3 arthritis here? You're looking at decades or years. But if you understand that this nervous system controls every function, there is never a defect in your body that causes blood pressure, cholesterol, bowel function, lung function. None of this is a break in the body. It's the body responding to stress. This is why asthma is not a problem of the lungs. It's a problem of the smooth muscle control of the lungs, which has to do with the nerve to the diaphragm, which comes out of here. It has to do with the cardiac and respiratory center, comes out of here. It has to do with the diaphragm insertion that comes out of here. And so if you look at all of that, then you look at other contributing factors to lung function. What about toxic food, poisonous food, digestion, pesticides that can all damage that? Dehydration can affect lung function. So all of those things, and I'm just talking lung function, we have 3 different areas of the structure that can be a problem. We have the nerve to the diaphragm that comes out of the base of the neck. Then we have dehydration and digestion and bowel functions because the lungs need this clear lubricant called surfactant in order to transfer. If the body is dehydrated, you start to produce mucus. This is why people with asthma have 10 times the amount of mucus in their lungs than a normal person. Now, I'm just talking lung function. This is how the body works. Can you imagine going to a doctor, they diagnose you with asthma and they give you a steroid without looking at why your body has that. In a chiropractic world, it's like, God, that's stupid. What about digestion disorders? Let's say that you have one poop a week. Why give a laxative? When your body, we know it's in a stress state. So we look for the physical, chemical, emotional stress. Does that make sense? So if you have movement of the joints, arthritis can be reversed. But arthritis is not damage. It's literally the body trying to stabilize an unstable segment. The only way that you can identify that that segment went from unstable, which is loss of curve, reverse curve, some type of deviation from normal, is to take a second x-ray and show that it's getting back in place. The cool thing is, you'll see discs regenerate, you'll see bone spurs go away, you'll see arthritis be reversed. And the side effect of that is your body functions better. Yeah, so we don't take x-rays to find out where you hurt. And this is, I was talking to a patient today. Have you ever seen a pain management center? Okay, I was down on Sukhumvit the other day, and there's a big center that says pain management. And I thought, God, if doctors were really honest, pain is never a problem. 90% of the nerves coming off the spine have no pain fibers. Pain is a fire alarm. And we just had a patient today that says, yeah, man, I have this pain coming all the way down here. Does anybody think she's suffering from a lack of medications? I know, it sounds stupid if I say it that way. It's like, no, it's an alarm. So when you see pain management, look at fire alarm suppression company. Yeah, I got this fire alarm going off in my house, and it really is irritating. If you call the fire department, they'll say, well, do you see smoke? Yeah, I can barely see across the room, but it's a fire alarm that's irritating me. That's dumb. The body is intelligent, it responds correctly. But now here, let's look at mental health when you're looking at anxiety and vitality. Anxiety, stress, and depression are all features of the frontal lobe. This is also schizophrenia, impulse control, attention deficit disorder. This is controlled by the cerebellum, the small brain on the back. The small brain in the back gets its information from the position and motion of the vertebrae. So when you have abnormal position and motion, you have abnormal stimulus from the cerebellum. And this controls the frontal lobe. So if you have loss of curve in the neck, reverse curve, degeneration, damage, structural deviations, and remember, when you're looking at the body from the straight, it should be straight up and down. From the side, we should have curves. If you have a body like this is abnormal stimulation to that cerebellum. And that's going to be anxiety, stress, mood fluctuations. You're not going to be able to adapt well. So you correct this, you change that stimulus, and then you can reprogram the brain. But you're going to see differences immediately by changing the stimulus to the brain and releasing the pressure so that fluid that the brain produces can start to flow. And every adjustment changes that sensory input to the brain. So now, when should you go get adjusted? Should you wait for symptoms? Okay, this is a common thing with the parents. Okay, and I know there's parents in the room. Okay, Doc, when should I bring my kid in? He's 5. Or when should I bring my kid in? She was just born. I said, well, okay, you could wait till they're really sick and then bring their bodies in and we'll help them. Or you could bring them in now and we'll make sure they're healthy. So what about you? When should you get your body checked? It really depends on your stress level. If I've got a patient who's head Hare Krishna priest, he's a mixed martial artist, he's got 6 kids, he is a stress magnet. I mean, tough guy. Okay, I'll see him twice a week the rest of his life. Okay, because he is constantly working this body and under stress. If you have somebody who's a yoga instructor, independently wealthy, no children, okay, That's no stress. I'll see her 4 times a year. But it really depends. You can't work on symptoms. You work on objective analysis where you're measuring something. Once you have achieved normal function, then you get checked on a regular basis to make your nervous system as clear of interference. This is why the old school chiropractors never say, "How you feeling today?" Because that's really bad information. 90% of the nerves have no pain fibers. So what I will ask is, how did you sleep? Because that's how the body regenerates. If I really want to talk to you, I'll say, how many bowel movements a day did you have yesterday? You know, because if you have 2 to 3 healthy bowel movements and you're sleeping good, dude, that means your body's regenerating. That's the most important part. But now let's say you have a damaged spine and high stress and high kids, okay? And you're living what's called normal. It really depends on what the frequency of visits is. This is why we'll do x-rays at 30 adjustments, whether it's 30 adjustments in 2 weeks or 30 adjustments in 2 years. You know, if I don't see you for a couple of years, beautiful, let's get a set of x-rays, let's find out. And then I find out in the last 2 years, wow, your body's really improving. Fantastic. Whatever you're doing is working. Or if we get a correction and I see your body declining over the last 2 years, whatever you're doing isn't working. And this is why we get patients from all around the world. And I'll say, look, great, you know, find a chiropractor. You know, it's like a bad day of fishing. It's still pretty good. You know, but we'll check. I'll give you a no-charge set of x-rays so we can monitor the progress to see if they're doing you a good job or not a good job. This is why you never let symptoms guide your care. And just think of that guy all day, golfing Sunday, feels great and dies of a heart attack Monday. We've heard of those, okay? He was not healthy. That's why you monitor the system that controls and coordinates every function. Any questions? Kapun krap. Thank you very much.